Well, joining us now is Dr. Michael Ryan. He's Executive Director of the World Health Organization's Health Emergencies Program. Thanks for being with us here this morning.
Thanks, Terry.
Now, we just saw the work that the World Health Organization is doing in Congo. How difficult is it to stop a disease like Ebola that can jump across borders and potentially go much further?
Ebola is a very difficult disease to stop at the moment, particularly in the context of DR Congo, where we have a mixture of conflict, displacement, and a very weak health system. So the chances that the disease can amplify and spread even across borders is quite high. The chances at global level are reasonably low because the disease does not spread by the airborne route, but there are many other viral pathogens that can do that.
Now, you're attending the World Health Summit that's taking place here in Berlin right now. The main focus of that summit this year is climate change. What impact does climate change have on the spread of diseases?
Climate and climate variability, climate change will impact on the spread of diseases in many, many ways. A lot of it's mediated by rainfall patterns and temperature patterns. Viruses, and particularly the vectors that carry them, are very sensitive to rainfall, humidity, groundwater, and that will drive vector-borne diseases. We've seen it this year with chikungunya, with dengue outbreaks all over the world. Equally, we will see diseases associated with drought or flooding. You cast your mind back a year ago, we had a major cyclone in Mozambique. Within a week of that cyclone, we had a massive epidemic of cholera.
What are the flashpoints for epidemics and diseases like you just described right now? Which regions of the world are most at risk, most affected?
I think everyone is vulnerable. But if we look at zones of great biodiversity in the world, the great rainforests and others, if we look at zones which have conflict and increasing populations with a lot of population movement, where populations are already vulnerable, like in DR Congo, but there are many other places like that. But we're all vulnerable, and major cities all around the world are vulnerable. They're not necessarily vulnerable to the disease emerging in the city, but they're very vulnerable to a disease arriving in the city and then causing a major epidemic. And again, we're seeing that more and more.
Is the world prepared for something like that, for the risk that these diseases pose?
I think we're at a stage of great vulnerability and great risk, but we're also entering an era of great capacity. We have technology, we have new vaccines, we have new drugs, we have better surveillance systems. We have communities that are connected all over the world. We're better connected communities than we ever have been. However, trust between communities and governments is at a low ebb. So how are we going to use the technologies at our disposal, use all the advantages of development and globalization, while managing those risks that are really there and in association with that globalization?
An appeal for multilateralism, it sounds like. Dr. Michael Ryan, Director of the WHO's Health Emergencies Program, thanks for being with us.
Thank you.